This is Bob. And this is Mary. And this is their son, Bob Jr., who is 9 years old. They're a happy, healthy family that like going on walks in the park with their dog, Buster. But this week, the family are not feeling so happy. Bob Jr. hasn't been feeling very well. Like some of his classmates, he has a sore throat and has been coughing. Mary's worried and thinks she needs to go to the doctors to get antibiotics. But Bob tells Mary that when he had a cold not long ago, his healthcare professional told him that antibiotics don't help you to recover from most coughs and colds, and he was advised to use medicines to treat his symptoms so that he would feel better. So the family decides to visit their pharmacy first. The pharmacist discusses Bob Jr.'s symptoms of sore throat and coughing with him and his parents. He explains that he has an upper respiratory tract infection, and the symptoms he is experiencing might last a few days to a week. Because Bob Jr. isn't at high risk of complications, a referral to a doctor isn't needed. Taking medicines to treat the symptoms, of which there are options for children, would be the best thing for him. Mary asked if antibiotics would help Bob Jr. The pharmacist explained that antibiotics are unlikely to help Bob because most coughs and colds are caused by viruses. Antibiotics don't work against viruses, so wouldn't make him feel better or speed up his recovery, and could risk them not working for him in the future when they are really needed. Together, the family and the pharmacist discussed the available over-the-counter treatments for his sore throat and coughing, including analgesics, throat sprays and lozenges, and cough syrups, and choose a child-specific lozenge for Bob Jr. The pharmacist also suggests an analgesic for Bob Jr. if he experiences any fever. The pharmacist tells Bob and Mary that Bob Jr. should start feeling much better after taking treatment, but they should take him to the doctor if his symptoms persist or get worse, or if they are worried. The family feel reassured, and Mary is much less worried. Bob and his family can avoid spreading germs by using tissues to cover their mouths when sneezing, putting used tissues in the wastebasket, and washing their hands carefully with soap and water. And if Bob's family come down with the same symptoms, there are a number of symptomatic relief options available. It would be best if Bob Jr. was kept off school so he has time to recover and is less likely to pass the bugs to all his friends. After resting and taking the recommended symptomatic relief, Bob Jr. starts feeling much better, and after a few days, his sore throat has gone away and he's no longer coughing. Bob Jr. is now back to school and getting up to mischief with his friends. By speaking to a pharmacist about Bob Jr.'s symptoms, Bob and Mary are helping their son feel better quickly and ensuring the appropriate use of antibiotics, therefore protecting the future health of their family.